Hey everyone, Dr. Mungli here. So we have been through first wave of COVID and then second wave of COVID and then we are on the way to third wave of COVID. So while this is going on, there is something called as post-COVID condition. So what is post-COVID condition? Although most people with COVID-19, they get better within weeks of illness, but some people experience a post-COVID condition, and this post-COVID condition has got a wide range of new or returning or ongoing health problems people can experience 4 or more weeks after first being infected with SARS coronavirus 2. So even people who do not have COVID-19 symptoms, even after being infected, they still manifest with these post-COVID conditions. So these conditions can have different types and combinations of health problems for different lengths of time. And all this is together, we call it as a post-COVID condition, and sometimes it is referred as a long COVID. Now, what is the clinical course of COVID-19? So most people with COVID-19 experience mild symptoms or moderate illness. So as it is shown here in the figure here, so exposure and then the onset of symptoms and the recovery happens within 2 weeks in mild or moderate cases, but approximately around 10 to 15% of cases progress to severe disease, and within that about 5% they become critically ill. So typically people recover from COVID-19 after 2 to 6 weeks of illness. Now what is post-COVID condition then? People who continue to present with a wide range of symptoms even after 4 or more weeks of COVID-19 are referred to have post-COVID condition. Now the post-COVID condition, it is also referred by some other names, like some of them refer it as a long COVID or like long haul COVID, post-acute COVID-19, long-term effects of COVID, or chronic COVID. Now what are the symptoms of post-COVID condition? So there are a variety of signs and symptoms that have been manifested by people who have suffered from COVID-19 and going into like 4 or more weeks of post-COVID-19, and still they continue to manifest with signs and symptoms. What all that? So as it is shown in the figure here, so people may have difficulty in breathing or shortness of breath, tiredness or fatigue, symptoms that get worse after physical or mental activities, or maybe like some people may find it difficult for thinking or concentrating, so sometimes it is referred as a brain fog. Then patients may manifest with like cough, chest or stomach pain, and headache. Then fast beating or pounding heart, which is referred as palpitation, can be experienced by some people after post-COVID. Then joint or muscle pain, and some people may experience pins and needles feeling. And then some people may continue to have diarrhea. Then some of them may suffer from sleep problems, fever, dizziness on standing, or like lightheadedness can be seen. And some people may show like rash, mood changes in the smell and taste may continue, although like at the time of COVID infections, changes in the smell or taste, or loss of smell, loss of taste is one of the important sign even for the diagnosis of COVID-19. It may continue later on, and also women with COVID-19, they may experience changes in menstrual cycles also. What is the treatment and prevention of this post-COVID conditions? So there are many unknowns here. So there are so many things that we don't know why post-COVID condition happens. So when there is unknown, so there is no definitive treatment here. So treatment is only symptomatic management that has been done right now. So the best way to prevent COVID-19 is to get vaccinated. So vaccination is the way to go. So got to get vaccinated against COVID-19 so that COVID-19 can be prevented, or even if the COVID-19 infection happens, it is just like mild or moderate, and it will reduce the hospitalization, it will reduce the morbidity or the severity of the illness by getting vaccination. And also note that like even if a person has got COVID-19 infection or post-COVID condition, it is better to get vaccinated so that the signs and symptoms are decreased to a certain extent. So this is all about post-COVID condition. Thank you.